Welcome to second episode of India Health Mission on Times Network, presented by Darwin Group, powered by Bacto-V, associate sponsor Herbal Life Nutrition and Newberg Diagnostics. And I'm Hina Gambhir. India's COVID count on a daily basis is rising by over 14,000 cases. That's right. And because of this only, we have already crossed the 4 lakh mark. You heard me right. Now, to be able to defeat this enemy, we need to make a lot of changes in our lifestyle, and that is exactly what we are going to discuss over the next 60 minutes. But before that, let's first hear what Prime Minister Narendra Modi said on International Yoga Day.
कोरोना पैंडेमिक के कारण आज दुनिया योग की जरूरत को पहले से भी अधिक गंभीरता से महसूस कर रही है। इम्यूनिटी को बढ़ाने के लिए योग की अनेक विधियां हैं, अनेक प्रकार के आसन हैं। वो आसन ऐसे हैं जो हमारे शरीर की स्ट्रेंथ को बढ़ाते हैं, हमारे मेटाबॉलिज्म उसको शक्तिशाली करते हैं। लेकिन कोविड-19 वायरस खास तौर पर हमारे श्वसन तंत्र यानी कि रेस्पिरेटरी सिस्टम पर अटैक करता है। हमारे रेस्पिरेटरी सिस्टम को स्ट्रॉन्ग करने में जिससे सबसे ज्यादा मदद मिलती है वो है प्राणायाम।
So this is what Prime Minister Modi said, that how yoga can actually help us boost our immunity, which will eventually help all of us fight coronavirus. Joining us on the broadcast this evening is Mr. Venkatesh Vijay Raghavan, CEO, Cavan Care. We have with us Dr. V.K. Monga, who is Chairman, IMA Hospital Board of India. Dr. Sanjeev Bagai, Chairman and MD, Nephron. We also have with us Dr. Rakesh K. Mishra, who is Director, Center for Cellular and Microbiology, CCMB, and also Dr. GSK Velu, MD and Chairman, Newberg Diagnostics. Welcome all of you gentlemen on this very special broadcast. But let me begin this discussion with Mr. Venkatesh Vijay Raghavan. Firstly, what do you make of what Prime Minister Modi said today, the importance of yoga to help all of us deal with this coronavirus pandemic?
I think it's the right message that I would say that's being given to the nation. In times of this pandemic, while yes, there's been a lot of hardship in terms of facing the pandemic, one of the important things that we all realize that immunity is important to fight this battle. And in this game, I think, therefore, working ourselves, working our health is important, and yoga definitely is one of the primary things that I would treat as key for us to be building up of immunity. In addition to our food habits and our other habits, I think exercising, health regime is a very important part of this whole game today.
Okay, but apart from that, since there is no vaccine still with us, what kind of changes do you think, Mr. Venkatesh, that people of this country can bring into their daily life to be able to live with this coronavirus? Because of course now many have started saying that prevention is better than cure. Asymptomatic patients are still not being tested across the country. So what is it that all of us can really do on a daily basis?
So yes, it's unfortunate that we are living in a day when we don't know what's going to be the vaccine coming out. But like you said, prevention is better than cure. And that means that at a personal level, at a group of people level, we need to start building our own immunity system. First of all, I would say that our food habits probably would need to change. Like many of the eminent panelists would say, like many of the eminent nutritionists would say, I think it's important that we stay focused on healthy, good food that helps us build our immunity. The second, I think in our rush, in our day-to-day lives, many of us would have probably not had a good, healthy regime of exercises. self-control. But I think that's something that probably is very important today for us to be able to build our strength. I think between a healthy regime of food, exercises, and a controlled way of living, possibly we should be able to look at a lot more prevention than just getting exposed to this virus at this point of time. And that's, to my limited knowledge, some of the few things that across the country, across the globe, people have started embracing as well.
Okay. We'll of course be discussing all of these with the doctors who are joining us on the broadcast. But another quick question that I have for you, Mr. Venkatesh. Now, the role of sanitization is going to be very, very significant. We are all being told to wash our hands, whenever possible, wash it properly at least for 20 seconds, use a hand sanitizer which has alcohol to ensure that you remain absolutely clean. Is that enough, or do you think there's more that needs to be done? Because, touching of surfaces is now a big cause of concern. What is your point of view?
I think sanitization is one way that we could probably prevent some of this from spreading. Of course, would you be able to do that on a continuous basis? The answer probably is no. And therefore, I think maintaining a clean surface, a clean working environment, a clean household probably is also one of the ways that we would probably be able to control some of this. Sanitization, however, is very important. Like I said, both at the personal level as well as at a public level, it's important that we keep our spaces clean. It is, yes, a reality that we need to sanitize the space. How we do it, how frequently do it is a matter of how we're able to focus and get this done. But however, at a personal level and at a group of people, I think it's important that we keep our places safe and hygiene. But at this point of time, more important that we stay safe and stay hygiene as well.
Okay. Dr. Sanjeev Bagai, 4 lakh cases in the country. We would not have really imagined this number in the month of April or May, but with more relaxations, the infections have gone up. It is scary.
I think more we test, more positivity in terms of total numbers we will get. And I have said this very often that the total number of cases should not scare us. The more we test, of course, we will be able to identify the people who are more positive in the community, in the society, which actually gives us the only true clinical picture insight to the mode of transmission. So it's not an ominous sign. It's a good sign to document what is happening in the community surveillance with regards to the positivity. What is extremely important is to keep what we call as the case fatality low. The case fatality in the true matrix is a daily progression with the ratio to a case fatality rate. Now we know that in India and in Delhi, the case fatality has been much lower than most other Western countries. So what really we need to focus is, if I may add with your permission, is to avoid the dreaded big 5 C's. So avoid closed spaces, crowded areas, clusters, community living, and comorbids. The comorbids need to be protected. And the mantra is really what we call as an SMS. S is for social distancing, M for mask, and S for sanitizing. That means keep your hands clean. So if we continue with these precautions, I'm quite sure we will be able to keep the mortality at a much lower level, and we'll be able to come out in a much better manner, because our healthcare at the present moment, in Delhi at least, is just about getting stretched.
Okay. Dr. Rakesh K. Mishra, now clearly testing is going to be very, very important, and we know that Hyderabad CCMB has recently developed a COVID test that can handle up to 50,000 times more samples. Could you tell us a little bit more about it, and why it is also now important to ensure that asymptomatic people are tested?
Right. So, as you already mentioned, another panelist mentioned, knowing the facts are very important. Numbers, we shouldn't be afraid. More we know, better we are to take decisions. So testing is like seeing around. If you know the landscape better, you will be able to navigate better. So there is a necessity to test as much as possible. Current tests, we have limitations. Country is testing maybe 1.5 lakh today. We need to increase it by 10-fold. Maybe we should be testing 1 million a day, and how to go about it. So there are ways people have been trying, and the method that you mentioned with CCMB along with the companies in Bangalore, Syngene is developing, is called NGS based testing. Here we do massive pooling of samples.
Okay.
And this method will be even cheaper, provided that we test large number in one go. And the approach will be that you collect several thousands of samples from many test centers, do preliminary processing of the samples there. I will not go into technology, and then pool those samples there, because we will have now barcoded the samples at the center, at the collection center itself, and they come to the NGS center. NGS is next generation sequencing, which is a modern technology for genome sequencing, and then we process the samples up to 50,000, as you mentioned, in a go, and in a day we will be able to decode the samples and tell who is positive, who is negative. So it will require logistics. Certain things are being worked out for this, and in few weeks we should be able to put this into place. But there are other methods which can enhance our existing capacity of testing. For instance, recently ICMR has approved antigen based testing. Although the sensitivity of the method is little bit less, but you can get still 60%, 70% positives, and then the remaining samples can be pooled and tested in a regular method of RT-PCR. That way you can increase the capacity by 4-5 fold. And there are other improvements. So I think in coming weeks we will see a huge enhancement in the testing capacity, and also I'm sure the cities and municipalities will take advantage of this and get a better picture of what is the extent of the disease. See, today we are saying that is the morbidity, that is the number of people needing support of health care from whatever number we are saying is infected. We know that most of the patients are actually asymptomatic. If we test large, then we will realize that in India we have even better picture. The morbidity will be even lesser, because right now we do not know the extent. There are estimates that maybe tenfold more number of people already infected who we don't know. So knowing will help us in taking decisions, how we, where we restrict more, where we allow people who have already developed antibodies. So these are the things that will help us in managing the disease much better, which we are doing all right. But I think as the number of cases increase, we will be able to take better decision if we have better perspective of what is the extent of spread.
Okay, that's very important. Dr. V.K. Monga, it's also then important that we have the correct projections given to us so that the decision can be taken accordingly, the strategies can be changed accordingly. Recently, Delhi government has projected that there are going to be 5.5 lakh cases by the end of July only in Delhi, and Delhi is going to require about 80,000 beds. Apart from this, Chennai has said that there are going to be 2 lakh cases by July 23rd, and they are going to require 40,000 beds. Do you think it is a realistic picture, or this will just add to fear mongering as far as coronavirus is concerned?
Then I don't agree that it is going to be a fear mongering or a panic situation, but definitely these both these estimates seem to be correct as of now.
Okay.
Because in Delhi you are approaching 4,000 cases a day. And even in Chennai, I mean, you are definitely going higher and higher. Delhi has already gone up to 56,000 cases in the last 2 months or so. And this was because there was no testing as such. Delhi was doing only 5,000 tests a day. But now it is going up to 18,000 tests a day. So many organizations by the government and everybody, they are now engaged in the testing procedure. And more the testing, more the reporting, but that should not be a panic, that should be only a figure. We should be more careful. Definitely that should give you alarm bells in your head that we have to work on this. Every case that is diagnosed in Delhi or anywhere in the country, precautions should be taken, how to quarantine a person, how to take him to a hospital, how to see to it that he does not spread the things further. Contact tracing, we have been always talking about it, but I'm sorry to say in most parts of the country there was not much of a contact tracing also, except for Kerala and Karnataka somewhere. But otherwise I think you diagnose a patient and then trace the contacts and then see how he got the disease and whom he has met in the last few days, and he may not have spread the disease. That is the fun of more testing, and more the testing, I think we should be able to control the disease in a better way. Let the numbers say anything, but we should be prepared for all these eventualities. The figure of 5.5 lakhs in Delhi looks okay, unless we take all precautions and we are able to defeat the things in Delhi.
Okay. Dr. GSK Velu, do we have enough health infrastructure as on this date in place to deal with this kind of a projection that we're talking about? 5.5 lakh cases, which Dr. Monga feels is looking realistic in Delhi, in Chennai, 2 lakh cases. Do we have enough infra to deal with this?
I think, thanks for having me on the show. So it is, we all know that the government is doing something over the past 3 months. I think earlier healthcare was lacking to some extent. We didn't really have the kind of healthcare infrastructure what was required to handle a pandemic of this magnitude. But we have to give the credit to the government over the past 3 months. They have done a lot. For example, when the country had 40,000 ventilators, maybe less than that, in the entire country, and the government has now made arrangement to buy 60,000 ventilators in the next couple of months. So when it comes to ventilators, when it comes to beds, I think you would have seen it in Bombay, Delhi, even in Chennai, COVID-specific hospitals have been created. Now, thousands of beds are being created. But it's important that we continue to do more, because this is not going to remain. Today, we are seeing the biggest problem in Bombay, Delhi, and Chennai. But I'm sure it's going to go to other cities too. So that is the reason we need to get prepared more in terms of healthcare infrastructure, and both state and central governments are doing their very best. So the healthcare infrastructure has to be improved. As every other fellow panelist said, the testing has to be improved so that not hospitalization should not be the only way a COVID-19 patient should be treated. I think the home quarantine, isolation, we have to combine all of that. I think if US can have 2 million plus patients, I'm sure India would have, 20 lakhs patients. Here US had 20-30 lakhs patients. I'm sure India is going to have more than that. So it's not that everybody needs hospitalization. The hospitalization should be done very carefully, and only people who are critically ill should be hospitalized. Otherwise, we should start using the basics, like the doctors were saying about SMS, home quarantine, and creating hotel care. I think some hospitals have now looked at even tying up with hotels to give care. So all these innovative means has to be done if we have to give care to every positive patient in the at least in the next couple of months.
Okay. Mr. Venkatesh, what is your assessment? How prepared are we, according to you, to deal with this? Or do you think to make the people of this country also a stakeholder in this particular fight? Because in many cases, home quarantine is something that's the need of the hour. More awareness, do you believe, is needed?
Yeah, I think we are at a stage where I keep saying, while public administration does what it needs to do, and I'm definitely sure that a lot of work happening, like a panelist is saying, it's important that we co-opt the public. A large part of the way forward is when we as public are able to exercise self-control. We are able to follow the regime that we are supposed to follow, both in terms of keeping ourselves clean, the self-hygiene that we are talking about, staying safe, secure. But I think more important is, like you said, it's important that the public as well as plays a role in terms of helping curb the spread of this whole virus. And I think we as citizens have a large role to play on that. Creating awareness, I think, is also equally important. While a lot of awareness has been created, we need to actually do more to be able to spread the right information to people about how they can maintain their hygiene, what can they do, what they are not supposed to do. I think a lot of work is happening, but still a lot more to go. And my sense is this is the way it would probably evolve till we get on to a stage where there is a determined medicine or a vaccine that comes out.
Okay, let's also now talk about, the kind of changes that we can bring into our lives. We've discussed what the situation currently is, and of course, the sense we get from all our panelists is that we don't need to be scared of the rising numbers. We need to prepare ourselves. Dr. Sanjeev Bagai, let me ask you first, is wearing a mask enough? Apart from washing the hands properly, is that enough for a normal person who probably can be asymptomatic to live a normal life?
It's a wonderful question. So there are three scenarios. So you have an asymptomatic carrier or an infected person versus, let's say, me or you, for example. If none of us are wearing a mask, if one of us are wearing a mask, or if both of us are wearing a mask, a cumulative calculated a computerized risk factor exceeds 45 to 50% if both people are not wearing a mask. So if both people are wearing a mask and it is properly fitted, it covers the mouth and the nose, the risk is less than 2 to 3%. So I think mask is extremely important. I must add over here, the mask should be properly fitted. It is not something which is to be worn for cosmetic reasons, which is dangling below the chin or not fitting well. It has to be changed frequently because it is not buy once and use forever. And very importantly is to keep a safe distance of 6 feet plus. Now you need, with your permission, if I can explain,
yes, sir.
Any person will need approximately 1,000 microns to get infected. If a person sneezes very loudly and is unprotected sneezing, the sneeze can go up to 24 feet, can drop the particles, and the viral load in one sneeze can cross 3 million. 3 million, and you need only 1,000 to get infected. So it's extremely important to keep care of our own hygiene etiquettes, wear a mask, keep social distancing, and keep washing your hands. Don't touch objects which are not necessary to touch, like tabletops or railings or doors, and make sure that you don't touch your vital parts of your face with hands which are not being cleaned.
Okay, but Dr. V.K. Monga, these are important things that we need to keep in mind. But as we are seeing relaxations coming in, people have started going to offices. These kind of issues are slightly difficult to actually practice. So what is your point of view? What additional measures people will definitely have to keep in mind apart from wearing a mask and perhaps using the hand sanitizer again and again?
I'm sure that is the irony of the situation. Go on the street, you will find many people riding their bikes without mask, or they'll be hanging their mask below the chin, not taking care of social distancing also. I mean, in spite of all the education and all the panic in their mind, all the negativity in their mind, still we are finding these type of people on the road. This is a real bad thing. I mean, the media has done a lot of work. The Prime Minister has talked about it a number of times. But I think somewhere total ignorance is lacking in many people. And we have to definitely work on these lines at the ground level so that people understand the issue. Because if I save myself, everybody starts saving himself, that will be the whole chain setup, you know. You go to a bank, you touch every surface over there. This is not done. This should be the education. Then, I mean, you go on the bus, you touch every surface in the bus. You know, all these things are going to add on, because anybody coughing, anybody doing anything, I mean, touching any surface is leaving virus behind. And that virus, if you are picking up and touching your nose or your mouth with that, you are getting the disease. And this is, I mean, some people say that I have not gone out of my house for the last 2 months, still I am positive. So these are the issues, because somebody in their house must have gone there, must have brought vegetables or milk, brought the virus, and then he touched that surface and got it. So these all things, I mean, these are the micro things which we must understand and ensure that nothing like this happens. We are not, I mean, becoming a part of the chain of the spread of virus. That is the most important part of this, and we have to, you know, make it a habit now. I mean, it is not that, I mean, in months or so we think that corona will go. No, this has to be a habit for all times to come. No crowded places, don't go there where there is a crowd, or the government should also ensure that even in religious programs or the mandis or wherever there are crowds, they should be stopped. Strict discipline of social distancing is a must, and wearing a mask in public should be 100% ensured. In spite of all these challans that are being done by the police in the country, we are not learning about it. I think we need to do a lot more work on this.
Okay, Mr. Venkatesh, what is your point of view? Because as Dr. Monga did talk about, somebody bringing vegetables from outside, even today there is a lot of apprehension. For example, in my house as well, if somebody is bringing vegetables from outside, there is a bit of concern whether it is safe to use it as it is or not, and if washing with normal water is also sufficient or not.
Yeah, I think that definitely is a concern. It's just not with vegetables. Whatever we bring out of the house, is there a concern that we're bringing in the virus along? And personally, for example, in my household, if you got to look at that concern remains, I'm sure a lot of people, common people, would have the concern. I think cleaning vegetables is also part of the regime, probably something that people should take care of now, not just with probably water. If there are multiple solutions to that which can sanitize the vegetables, it's equally important that we look at that. So not just vegetables, but across the board, whatever we bring in, like one of our panelists is saying, we need to keep our surfaces clean. It's equally important that we are careful about what we bring into the house. It's not about only the people, but also about what we bring into the home. How clean are we able to maintain them? How are we able to sort of sanitize them and ensure that we don't allow any space for the spread of the virus?
Okay, and how do we actually sanitize them properly? That is something that we are going to be discussing when we return after this very, very short break. Stay with us. Welcome back. Here with us on India Health Mission on Times Network, presented by Darwin Group, powered by Back2V, associate sponsor Herbalife Nutrition and Newberg Diagnostics. Now, we're talking about how to live with coronavirus, because number of cases are rising on a daily basis. So it is now upon us to make changes into our daily life to prevent this coronavirus from reaching us. And our guests continue to be with us. Dr. Rakesh Mishra, I want to ask you, we were talking about how we need to now start bringing changes, and most of our guests agree that, the numbers will rise. We don't have to be scared with the rising numbers. Recently, the news came that a new drug is going to be available, a COVID drug, at 103 rupees per tablet, perhaps by the end of this month. Can you tell us a little bit more about it? I mean, at what stage are we really in terms of bringing a vaccine?
See, we are in a situation where this is a pandemic and it's treated as an emergency. Many of the things that you are hearing about drugs, they are actually still under the process of development and trials. And when something gives some positive, little bit of a hope, then in an emergency situation, these are allowed to do. Similarly, like plasma therapy. So we have to wait a little bit. If we are lucky, maybe some drug will come. But at the moment, these are temporary measures, I will say, and we should practice hope and depend more on what just for 15-20 minutes we have been discussing how to protect ourselves from getting infected. Coming to the vaccine, this is something which is a very tough thing to predict, that whether we will have vaccine and when we will have the vaccine. Please remember that there is no effective vaccine against any coronavirus till now, and we are working hard. I mean, things like AIDS or HIV, there is no vaccine. For several decades, people have been working. Having said that, there are unprecedented amount of effort and resources that are being put for this single virus, which has never happened in the history, which means and with the improved technology. So there is a chance that we will have something, but not for this pandemic. We will probably have vaccine next year sometime. So at least 6 months or 8 months or 1 year, I would add, if we are a little bit lucky with that. So we should focus on what is immediately effective. There are few positives which are associated with this virus. One is we know how the virus spreads. You already heard that virus spreads only from person to person. So if we know how it spreads, we should take care and prevent it from spreading, break the chain of spread. That is one thing. We have already, this virus had done one thing good, that we are more careful about our cleanliness, our health status, and doing practice exercises and eating properly, because health is important. That will keep your immunity up, and then we will be able to fight the virus.
Okay.
Our body is constantly fighting against thousands and thousands of bacteria and viruses. So this we will do better, but we should not sit and wait for a drug and vaccine. We have to take action now, and which is, you already heard the SMS, which is wear the mask, keep physical distancing, and don't let the virus enter through hand when you touch something. So wash your hand with the soap. That's the simple and that's most effective way of doing this.
Okay, that's important. 5 C's, as Dr. Bagai had mentioned earlier, SMS and wearing a mask are the couple of things that we need to really keep in mind. But Mr. Venkatesh, coming back to the point that we were discussing earlier, that how, when we bring, say, fruits, vegetables from outside, how do we need to ensure that they are properly sanitized? Mr. Venkatesh? Okay, yes, we can hear you now. Yes, go ahead, sir.
While washing away vegetables and cleaning it the way that we normally do definitely cleanses away some of the dirt, I think we need to probably also look at ways and means of removing some of the pesticides and also some of the sticking, if the virus were to stick onto the vegetables through any means, how do we remove that? I think we need to take precaution, and there are some innovations that companies have done, including bringing in specific ways of cleaning vegetables and removing some of the dirt beyond just the dirt, but also removing some of the pesticides and some amount of bacteria. I think that's something that probably as a practice, if we were to practice, saying that vegetables, fruits, whatever we bring from outside, if we can clean them better and also sanitize them, I think that would help us.
Dr. GSK Velu, now, the role of diagnostics is also very, very important, because these are the kind of preventive measures that need to be taken. But at the same time, it's important to identify the people who have coronavirus or not. What is your point of view?
I think we have been scaling up diagnostics over the past few months. ICMR has been doing a great job of continuing to come with multiple guidelines every few weeks once. And now I think one of the great things which has happened is, when we started this pandemic, we were almost 100% import dependent for these COVID testing kits. Today, I think due to this Make in India initiative, today I think more than 10-20 companies are producing these kits right here in India. So that has also brought the cost of prices down. So we started with 4,500 rupees in private labs. Now the prices have come down off of it in many of the states as fixed by the government. So both access and affordability is increasing. So I think private and public sector together has to come together. In this, I think there is no necessity of telling public health will work independently of private health. It's a time for both private and public players to come together to scale up the testing. I think as people are saying, it's now already we are reaching 2 lakhs tests per day, but probably we should be doing million tests, as Dr. Mishra was saying. So for that, we need to do multiple platforms. The RT-PCR still remains as a confirmatory test, and the next-gen sequencing will form a major part of how we want to do testing in the future. So we need to use antibody testing for knowing how is the immunity status of the population. The combination of antibody testing, antigen testing, RT-PCR testing, NGS-based testing, next 2-3 months is going to be very key in the country. When we have 1.3 billion population, I think testing and diagnostics is going to play a very big role. And if we actually catch it early and either home quarantine them, isolate them, that's going to really also help to stop the spread to happen across the country. Because one of the things which we all have the responsibility to do is not to take this virus to our rural areas and villages. So for that, I think the only way we need to do is to actually contain it in the cities and not allow it to go to the villages. Then we'll have a bigger problem in hand, because the healthcare infrastructure in these rural areas and the villages are not as good as some of the top 20 cities we have. So I think it's time the testing will play a very important role. Private testing also should be enhanced. And public testing should be also going up, and we should start using innovative technologies like NGS to do the enhanced testing in the coming months.
Okay, you've raised a very important issue that we have to ensure that this doesn't really go into the rural part of the country, though it has already started going with a lot of migrant laborers moving from one state to the other. How India can deal with that aspect, we'll discuss on the other side of the short break. Stay with us. Welcome back. You're here with us on India Health Mission on Times Network. We are discussing how we can help deal with this coronavirus pandemic and what are the kind of changes we need to bring in our life. And before we slip into a break, the focus, of course, was that we need to ensure that rural part of the country is protected. Dr. Sanjeev Bagai, I want to ask you specifically on this aspect. You know, when the coronavirus pandemic actually started hitting parts of Mumbai, it started impacting the slum areas there was a lot of concern, but Dharavi has managed to flatten the curve after becoming a hotspot. But on the contrary, big cities like Delhi, Mumbai, Chennai, Ahmedabad are the ones where we are seeing a spike in number of cases. So what should be the focus area, and why do you think this is happening? Is it because in rural areas the immunity is better of the people?
This is a critical question. Now, I mentioned the aspect of overcrowded areas and clusters. Now, when you have identified a very large cluster and you're finding positive patients, we cannot leave that identified person in the cluster. So you have to disengage them from the other routine crowd, otherwise it will continue to spread. We were anticipating and hoping that the summer heat is going to decrease the spread. Well, that hasn't happened, and the recent data which has come out is that at this temperature, in fact, the transmission is higher, and with the relative humidity, with the sporadic rain, the transmission is almost 7 times more than otherwise. Now, the way forward, what I feel personally and clinically is that when you have identified people, you need a very quick zoning, mapping of the people for contact tracing. And that can only be done as a community surveillance with a ELISA test. That's your antibody test. That's the only way you can get a very detailed clinical mapping of the mode of transmission. And the second thing with regards what we have learned from the Bombay experience with regards Dharavi is absolutely military cordoning off those zones. Now, we don't have to put a stigma. I think the stigma part and the panic part in a common person, especially with the label on the gate or the door of the house, is causing a huge amount of panic in a common person. And I fear that a person may not come forward for testing, may hide the symptoms. And in the end, I must add that early diagnosis, early intervention, isolation, and indeed early treatment is critically important. Because what kills a patient in corona when it goes from moderate to severe is hypoxia and dehydration. So the real message as a public campaign is that there is no stigma, there is no need for any anxiety or panic. A large number of patients are transient and self-limiting. Reach to the medical facility as quickly as possible if you have symptoms.
Okay, Dr. GSK Velu, will you like to add in terms of dealing with the health infrastructure in the rural areas?
I think the same thing. I think government has to do something, and they are doing about particularly the availability of ventilators, availability of critical care beds. All these need to be. I think one good thing is we have already got some time. So if it has happened all at a time in multiple cities, we would have been in a disaster situation. Now that I think we are also going stage by stage, and by actually doing this multiple lockdown, the government has effectively actually extended the whole pandemic. We all think we should be done with it in few months. By actually having it extended for a few more months, we have had that time, the luxury of time to build infrastructure in, particularly in the smaller towns, if not in villages, at least in smaller towns, we are building infrastructure. There's almost 60,000 ICU beds are being created across the country. And there are multiple COVID hospitals being created, not only in big cities, but also in smaller towns. So all this, I think both state governments and central governments have done reasonably a good job in creating all this and preparing for the future.
Okay, and we'll slip into another very short break, but when we return, we'll give each of our guests the final word as to what is their piece of advice to the viewers watching this show today. We'll be back after a short break. Welcome back. You're here with us on India Health Mission on Times Network, presented by Darwin Group, powered by Back2V, associate sponsored Herbal Life Nutrition and Newberg Diagnostics. And we discussed the coronavirus pandemic situation in the country and how we can deal with it. I want to give all my guests last 10 seconds each their closing comments. Let's begin with Mr. Venkatesh Vijayaraghavan.
Thank you. And I think my message would be stay safe, stay secure. But I think as we keep answering this panel, staying healthy is also equally becoming important. And this pandemic, in a positive way, possibly is helping us revisit some of our roots.
Right.
I would therefore tell my friends, the public, let's stay healthy. Let's go back to our roots again.
Okay. Dr. GSK Velu.
So I have 4 advices. The number
10
one
seconds
is
you
increase
have.
immunity. Yeah, increase immunity by eating healthy and doing yoga. Then test early and test more. And the last one is use technology, something like this Arogya Setu for contact tracing and isolation better. And last but not the least is take care of our villages, improve the infrastructure in villages. If eventuality happens, we should be prepared.
Dr. V.K. Monga.
It is for the government. They should increase budget allocation for health care. That is most important. They should go for PPP mode in case they are not able to afford it.
Okay.
And then people should not take it as a taboo.
Okay.
It is not a taboo. They should take it as a general disease, take care of it, go for diagnosis and go for treatment.
Okay.
That should be the message.
Dr. Rakesh K. Mishra.
Right. So, since we know how the disease spreads, let us block it. And since we know how to block it, we should practice it. It is our responsibility, our social responsibility, that we assume that we may be infected and we assume the other may be infected. At the same time, we should also assume that there will be drug, there will be vaccine hopefully, but maybe not for now. So we have to do social vaccine, which is, let us not prevent this and work normally. More than 90% the people don't need hospitalization, don't need to panic. Very few people who are more at risk, elderly people, should prevent getting
Prevention is the key. Dr. Sanjeev Bagai, what should be the mantra? 10 seconds.
The mantra is really, from social distancing, we need to move towards social responsibility. Do not self-medicate at home. There is no stigma. There is no fear. Reach for medical aid quickly. And in the end, I would like to add, the final comment is, the mental state of patients during the lockdown and post-lockdown has to remain strong. We want the people not only physically fit, but mentally and psychologically fit too, for a stronger India.
All right. Thank you very much, gentlemen, all of you, for joining us on this very special broadcast. We'll, of course, be back next week, same time.